The hidden dangers of incorrect blood pressure measurement. Accurate measurement of blood pressure is vital for diagnosing and managing various cardiovascular conditions, making it a cornerstone in clinical practice. However, despite its significance, several common mistakes often occur during blood pressure measurement, leading to inaccurate readings and potential misinterpretation of a patient's condition. Recognizing these pitfalls is crucial to ensure the reliability of blood pressure assessments and the delivery of appropriate medical care. In this discussion, we'll explore 7 prevalent mistakes encountered in measuring blood pressure, shedding light on the importance of proper technique, equipment calibration, and environmental considerations to enhance the accuracy of this fundamental clinical parameter. The first mistake in measuring blood pressure revolves around the choice of equipment. Many individuals opt for wrist monitors instead of arm monitors, which can lead to inaccuracies in blood pressure readings. While wrist monitors offer convenience and ease of use, they are prone to errors due to their placement away from the heart. Unlike arm monitors, which are positioned at the level of the brachial artery, wrist monitors may not capture blood pressure accurately. The brachial artery, located in the upper arm, is closer to the heart and provides a more reliable indicator of blood pressure. Consequently, using a wrist monitor can result in readings that deviate from the true blood pressure value, potentially leading to misdiagnosis or inappropriate treatment. To ensure accurate measurements, it is crucial to adhere to guidelines recommending the use of arm monitors positioned correctly on the upper arm. This simple adjustment can significantly improve the reliability of blood pressure measurements, aiding in the proper management of hypertension and related cardiovascular risks. The second common mistake in measuring blood pressure is overlooking the potential benefits of medication for managing high blood pressure. Some people may hesitate to take prescribed medication, fearing side effects or relying solely on lifestyle changes. However, medication can play a crucial role in reducing the risk of cardiovascular problems by up to 25%. Think of it this way. If you're dealing with high blood pressure and your doctor recommends medication, it's because they've weighed the risks and benefits. Sure, medication might come with some side effects, but those are often outweighed by the significant reduction in cardiovascular risks it offers. But here's the catch. Sometimes, even if your blood pressure seems normal, the measurement could be off, leading to potential misinterpretations. This can result in unnecessary concerns or missed opportunities for appropriate treatment. So, if you're on medication to manage your blood pressure, it's likely the right call. Just remember, it's crucial to stay consistent with your treatment plan and keep an open dialogue with your healthcare provider. After all, managing your blood pressure effectively is all about finding the right balance between medication, lifestyle changes, and regular monitoring. The third mistake in measuring blood pressure is not giving yourself enough time to relax before taking a reading. Picture this. You've just rushed to the doctor's office, heart still racing from climbing those stairs or briskly walking from the parking lot. Your blood pressure reading might not reflect your true health status because physical activity can temporarily elevate it. Now, here's the thing. It's not just about the immediate rush. Even stress from the day, like dealing with work deadlines or family obligations, can subtly elevate your blood pressure. That's why it's crucial to take a moment to chill out before getting that reading. Imagine this scenario. You've carved out a few minutes to unwind, maybe take a few deep breaths, and let your body relax. Suddenly, your blood pressure reading is more accurate, giving your healthcare provider a clearer picture of your health. So, next time you're about to check your blood pressure, take a beat. Whether you're at home or at the doctor's office, give yourself a chance to decompress. Trust me, your heart and your blood pressure will thank you for it. The fourth mistake in measuring blood pressure is not considering how your body might react differently in certain situations. Let's break it down. Sometimes, your blood pressure can drop sharply in one scenario and rise in another. But here's the kicker. In both cases, the values change, potentially giving your doctor the wrong idea about your blood pressure. Imagine this. You've just finished a relaxing yoga session, and your blood pressure drops. Or, you're feeling a bit stressed after a heated argument, and suddenly, your blood pressure spikes. These fluctuations can happen to anyone, but they can be misinterpreted if not taken into account during measurements. Think of it this way. Your body is like a complex puzzle, and different factors can influence your blood pressure readings. By understanding these nuances, you and your healthcare provider can paint a more accurate picture of your cardiovascular health. So, next time you're getting your blood pressure checked, consider what's been going on in your day. Whether you're feeling relaxed or stressed, knowing how your body reacts in different situations can help ensure your readings are more reliable. The fifth mistake in measuring blood pressure is underestimating the impact of stress on your readings. Let's dive into it. Just a simple bout of stress, whether it's from playing a competitive video game or watching an intense movie, can send your blood pressure soaring. When you're stressed, your body releases adrenaline, which causes your blood vessels to constrict, leading to higher readings. Now, here's where it gets tricky. Even mundane things like staring at your phone, working on your computer, or dealing with a flurry of emails can stress you out without you even realizing it. And guess what? All that stress can directly affect your blood pressure. Imagine this scenario. You're at the doctor's office, and your blood pressure reading is higher than usual. But before you panic, consider what's been going on in your day. Have you been feeling overwhelmed? Stressed out? Those factors could be influencing your reading more than you think. So, the next time you're about to check your blood pressure, take a moment to unwind. Put down your phone, step away from the computer, and just breathe. Trust me, your blood pressure, and your peace of mind, will thank you for it. Now, let's talk about the sixth mistake in measuring blood pressure. Jumping to conclusions based on what you've eaten. Picture this scenario. You've just had a hearty meal, and a few hours later, you're getting your blood pressure checked. Suddenly, the reading is higher than usual, and you start worrying that you have high blood pressure. But here's the thing. What you eat can indeed affect your blood pressure, even hours after you've finished your meal. That's because certain foods, especially ones high in salt or fat, can temporarily elevate your blood pressure. Imagine this. You've indulged in a big lunch, loaded with salty snacks and rich foods. Now, a few hours later, your blood pressure reading might be higher than it normally would be. It's not necessarily a sign of chronic hypertension. It could just be your body reacting to what you've eaten. So, before you panic about high blood pressure, consider what you've consumed recently. It's essential to maintain a balanced diet and be mindful of how different foods can affect your body. And remember, if you're concerned about your blood pressure, it's always best to consult with a healthcare professional for personalized advice. Alright, let's delve into the seventh mistake when it comes to measuring blood pressure, assuming that every high reading means you need medication. Here's the deal. Sometimes, a single high reading doesn't necessarily mean you have chronic hypertension. It could be influenced by various factors like stress, recent activity, or even what you ate. Imagine this scenario. You're at the doctor's office, and your blood pressure reading comes back higher than usual. Suddenly, you're worried that you need to start popping pills to manage it. But hold up. Before you jump to conclusions, consider what might have contributed to that high reading. Think about your day. Have you been feeling stressed? Did you just finish a workout? Or maybe you had a salty snack earlier? These factors can all impact your blood pressure in the short term, without necessarily indicating a long-term problem. So, the next time you get a high reading, take a moment to breathe. It's essential to look at the bigger picture and consider all the factors that could be influencing your blood pressure. And of course, always consult with your healthcare provider for personalized advice on managing your blood pressure and overall cardiovascular health. Thank you for watching. See you in the next video.